Hello, everyone. Welcome. We'll get started in just a few minutes. Where is everybody joining from? I see we have a few people already joining us. I am in Virginia, and it is currently snowing here. And we had one weather station say we were going to get 8 to 10 inches and another one say 2 to 4. So we really have no idea, but it is snowing pretty hard. Texas. It's probably nice and warm there. Awesome. We have everyone from all over. Florida, that sounds wonderful. California. Ghana. I love when we have people from all over the place, all different countries. The Philippines. So welcome, everybody. We're going to get started in just another minute. I just wanted to get us started, let some people in. We have Krista in the chat. She'll be moderating the comments. She's one of our nurses here at NCLEX Bootcamp. So feel free to drop any questions throughout, interact with her, and she'll get to any questions that you all have. Awesome. Everyone from all over. Oh, there's the Canada. Awesome. If you're just joining, I was telling everyone that it's snowing here in Virginia, and we have no idea how much we're about to get. We have two different, extremely different forecasts. All right. Well, it is 2:30, so we'll go ahead and get started. Thank you all for joining us for this BOWTIE on this webinar on BOWTIE questions. So BOWTIE questions are kind of new. Have you all been practicing them in school at all? Have you gotten practice questions for BOWTIEs? They're definitely, hopefully people are starting to get a little bit more used to it, but I'm going to give you guys some tips and tricks. So I'm Miriam. I am going to be presenting this today and walking you guys through BOWTIE questions. Before we get started, if you all want to jump over, or after we finish, if you want to jump over to our Facebook page, if you have not already joined there, you can join and invite your friends. We have a student dedicated NCLEX Bootcamp page on Facebook where students can help each other, ask questions, and get lots of good info over there. So we are going to first talk about what a BOWTIE question is, and then we're going to end up practicing one together at the end. So in this beginning part, I want to kind of just go through what they are, some tips and tricks to help you be successful with them as you approach these questions, and then we'll dive in. Okay. So the first thing to know before we get started on the BOWTIE question is I want to show you this important information about these next-gen style questions. Like BOWTIE questions are one of those next-gen style questions. So clinical judgment is really important, and the new next-gen NCLEX that we've been working on for the last couple years measures clinical judgment, and it's broken down into these 6 steps that you see here. So it's broken into these, and we have recognizing cues, analyzing cues, prioritizing hypotheses, taking action, and evaluating outcomes. And I know this might not make a whole lot of sense, but we're going to use these steps as we break down our NCLEX question, our BOWTIE question. So let's first talk about the parts of a BOWTIE. So you're going to have your instructions that are given. These are standard. And then you're going to have scenarios and data tabs. So this could be anything. This could be a nurse's note. It could be lab orders. It could be multiple things. It could be diagnostic results, anything like that. So you're going to have these data tabs to read through and your scenario. And then you're going to have headers here that you'll see, which is going to be our actions to take. In the center, we have our potential conditions, and then our parameters to monitor. So this is what you're going to pick from. In the center column, you're going to first pick your potential condition, and you have 4 options, and you'll drag that up to your center BOWTIE here. And then you're going to pick 2 actions and 2 parameters to monitor. And you'll drag them up into the answer spaces, and it looks like a BOWTIE. So that's how it has its name. So a big question we get is, will I have a BOWTIE on my NCLEX? And how are BOWTIE questions scored? So great question. With these, they appear on the NCLEX after completing 85 questions. And you could also see them as pre-test items. So how are these scored? The good news about bow tie questions is that you're going to earn 1 point for each correct response. So you can get up to 5 points. So obviously 0 points for any incorrect box, but 1 point for each correct answer. All right, so let's talk about some strategies to help make this a little simpler, because it is really overwhelming, I think, when you look at these bow tie questions and you have all these different options and different data tabs and things to take in and to consider. So as you approach these questions, I want you to first read the scenario and then review any data tabs. As you do that, you need to ask yourself if each of the findings that they're giving you is normal, expected, or is it abnormal, concerning. So as you do that, after you do that, you're going to consider each column separately. So you're going to first go to those potential conditions, and I want you just to think of this as a simple multiple choice question. Ignore the actions and the parameters in the other columns. So think about, what is this client most likely dealing with? What condition does she most likely have based on the information I'm given? And then consider these other ones as a select N, these other two columns, because you're only selecting 2. So you know that there's only 2 correct answers there, and you're going to select what fits best to deal or handle these actions to take for the condition and parameters that we want to monitor for that condition. All right, so let's practice one together. So first we have our instructions here. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing, 2 actions the nurse should take to address that condition, and 2 parameters the nurse should monitor to assess the client's progress. Now, you might see here this keyword, this most likely. So that's really important, because with all the information that they're going to give us in the data tabs in the scenario, any of these conditions are possible. Any of the actions to take are possible things, or things that we would do, and as well as the parameters to monitor. However, it's the things that we're most likely doing for this condition, or the most likely condition that the client has. So what are the findings telling us? All right, let's take a look at this together. So for here, our data tabs, we have progress notes and we have lab results. So as I read through this, I want you all to consider what's normal, what's abnormal, what's expected, or what are we concerned about. Okay, client delivered a healthy baby 3 hours ago, placenta intact. The uterus is boggy and 1 finger breadth above the umbilicus. The client reports mild perineal discomfort and is feeling too tired to hold and feed her newborn. Lochia rubra noted on the peri pad, saturation of 2 pads in 2 hours. Okay, so next let's look at our lab results. So it looks like everything is in normal range. We have our reference range is all here. It looks like everything's on the low end, but they're still within normal limits. Okay, so what do you all think? We're going to do this recognizing cues. What do you see that was concerning? And there's a little lag, so I'll give you all a second to put in your suggestions in the comments here. What do you think is concerning when you first look at this, the progress note, or if you thought anything was concerning in the lab results? Any ideas? What do we think about the uterus is boggy? Are we concerned about that? Yes or no? Yeah, so I see, great job, that boggy uterus. So we're concerned about that because the uterus should be what? It should be nice and firm. Boggy equals bleeding. Just think of that, B&B, boggy equals bleeding. So that's not good. What about the location? We have 1 finger breadth above the umbilicus. Where should that uterus be right after delivery? Yeah, Meg, great. You said the uterus is above. Absolutely. So it should really be at umbilicus, at U or lower, right after delivery. It'll start to kind of refill with some blood a little bit after an inflammation happens. But right after delivery, we should at least be at U. So it's above the umbilicus. So it's up a little higher. I see, great job. I see the saturation of the peri pads and the bleeding that we're having. So we are concerned about that as well, because that's excessive bleeding, right? We shouldn't have more than soaking we should not soak a peri pad in an hour, and that's what this is equivalent to. So we have some very heavy bleeding. Are we worried about anything about, what do we think about? She's feeling tired, too tired to hold her baby. Or about the perineal pain. Is that pain mild? Perineal pain, is that expected? Oh, I see people taking guesses that we think the bladder might be full. Okay. Definitely, when that bladder's full, it's going to push that uterus up. What do we think? Are we worried? We expect to have that mild pain, right? She just had a baby. Yeah, normal, Posh. Good job. So, and then feeling tired. I mean, she just had a baby, right? She should be tired. Definitely, yes. Pina is expected. Exactly. Okay, and I don't see anyone being concerned about her lab results, and I'm not either. Those lab results are all within normal limits. Definitely something we might want to watch, but all right, so analyzing cues, what does it mean? This is our second step. So now I've highlighted here kind of our things that we found concerning. And then let's take a look at our potential conditions. So uterine atony, a retained placenta, vaginal hematoma, and DIC, or disseminated intravascular coagulopathy. So as we look at this, remember that we have to think about what is most likely. She is showing us some signs of all of these things. So what do we think about uterine atony? What does that mean? Uterine atony means we're boggy, right? So we definitely do have that going on. It's without tone. Boggy equals bleeding. Remember that. Let's take a look at all of our options though. Retained placenta. Anybody think that it could be a retained placenta? So we would definitely have this excessive bleeding after delivery if we had a retained placenta, because that body's trying to bleed and it's passing clots and it's trying to get that foreign placenta out of it because it's not needed anymore. But with that, our uterus would not always be boggy. A lot of times the uterus is firm with that. So I don't know that we have enough to say that it's a retained placenta. Plus, we also see that the client's placenta was intact. So that to me is saying that that is not most likely what is happening. So the next one is a vaginal hematoma. What's a hematoma? What would that look like? Here's a little tip while you guys are studying and preparing for tests or the NCLEX. When you do a question, think about any answer that you don't think is correct. Think about what you would need to change it to make it correct. It just kind of adds an extra piece to your studying. So what would a hematoma look like? We would see swelling, edematous area, bleeding into the tissue, right? We wouldn't necessarily see heavy vaginal bleeding because that bleeding is collected in within the tissue. So the other thing is that this client only has mild perineal pain, and a big tip with a vaginal hematoma or any hematoma is that they have pain that's unrelieved with pain medication, and it's definitely not mild. So I don't think that it's vaginal hematoma. And then the last one is this disseminated intravascular coagulopathy. So let's talk about DIC. So DIC is an overactivation of the clotting cascade. And clients do bleed a lot with this, right? But what happens? They have this precipitating event happen, which could be a hemorrhage, it could be sepsis, they get really sick, and it's just gonna overactivate the clotting cascade. And what happens is they start to bleed and their body forms these little clots to stop it. And then they bleed, they break down those clots, and it's just a clot, bleed, and then they run out of clotting factors and they continue to bleed. But why would it not be DIC? What do you think? Remember, all our labs looked great for this client, right? So for this client, if she was having DIC, we would have seen her clotting times, those bleeding times would be elevated, her hemoglobin would have been lower, but all of that lab work looked normal. Now, we definitely need to watch out for this because this hemorrhage could lead to that. But right now, what is most likely happening, and I see people putting that answer, Posh, uterine atony. Absolutely, I agree. So with our prioritizing hypothesis, our next step, this is where we make our final decision. And what we think this is, which we've agreed, is uterine atony. All right, so next we get to generate solutions. So this is where we decide, what can I do? What am I going to do about this? Okay, so we have all these actions to take, and remember that we might do all of these for any client, but we have to find the two that are most likely and going to help with our uterine atony. So the first thing I like to do is think, what's my goal with uterine atony? What am I trying to do? And So what are we trying to do? What's our goal? What kinds of interventions do we want? We want to look for interventions that are going to slow and control the bleeding, right? Do we all agree? So let's keep that in mind as we go through all of our interventions. So let's see. Posh is on it. So she's saying administer oxytocin and perform fundal massage. So let's take a look at all of our options here. So actually, let me show you all this image that we have. So these are, for postpartum hemorrhage, our causes and our interventions. So there are 4 T's of postpartum hemorrhage. Tone, that's our boggy uterus. That's what we got going on, right? We have trauma. We have tissue or thrombin. So trauma would be like a bad tear that's maybe unrepaired, tissue, retained placenta, and thrombin would be like our DIC. Trauma would also be our hematoma. So now we can look at what kinds of interventions we're looking for, because not all postpartum hemorrhages are treated the same. So for our tone, we are going to be looking for doing fundal massage, giving oxytocin, carboprost, or misoprostol, just medications that would firm up that uterus. Okay, so keeping that in mind, we'll take a look at all of our options. So oxytocin, what is that? Oxytocin is a uterine stimulant. So what does that mean? It's going to help firm up and contract that boggy uterus. We definitely need that, right? So I think administer oxytocin, but let's keep looking. The next is perform fundal massage. Okay, so this is what a fundal massage looks like. And keep in mind, because this is a question that the NCLEX loves to test on too, is how we are positioning our hands for these fundal massages. You want to have one supporting hand underneath the uterus with one massaging hand on top. This supporting hand is really important because it's going to keep the uterus in place so that you don't accidentally massage the uterus and push it out of the vagina and have a prolapse. We don't want that. So definitely we want to give these fundal massages, and you could be giving this fundal massage forever. It feels like, because you're doing it until the uterus firms up, till these medicines kick in. We had a postpartum hemorrhage at my job the other day, and we were trading off doing fundal massage for probably 30 minutes. So you definitely get a good workout in. All right. So looking at our other options, we have apply ice to the perineum. So would we want to do that, or when would we do that? We would definitely do ice to the perineum anyways for any vaginal delivery, but specifically if a client had a hematoma. Remember that applying that ice is not going to slow or control that bleeding, right? It's just going to be comfort. And then prepare the client for a manual uterine sweep. So when would we do that? We would do that if the uterus wasn't intact, right? The provider would go in and try to remove any clots or any retained tissue fragments. So we don't have a retained placenta. And then the last one, prepare the client for an abdominal ultrasound. So this is done when we can't figure out where the bleeding is coming from. If they need to take an ultrasound, take a look to see, are there retained fragments in there, or what exactly is going on. So that is not needed for this client either. It's not going to help slow or control her bleeding. All right, so now we get to take action. So what do we decide on? We decided on performing fundal massage and administering oxytocin. So our last piece is we get to evaluate our outcomes. So this is where we get to reassess and see if our interventions helped. This is going to be a direct measurement of the actions we took and if the client's condition is improving or getting worse. Okay, so here we have another select N where we're going to pick 2. So we have our hemoglobin, uterine tone, temperature, vaginal pain, and vaginal swelling. Again, all of these things we are going to do for this client, but we need to find the 2 that are going to help us know if we have fixed this. Have we been successful at slowing and controlling the excessive bleeding? Is the mom okay and stable? Those kind of things. So what do we think? Hemoglobin, what's that going to tell us? Hemoglobin is going to tell us about those red blood cells, right? She's losing blood, so we definitely want to monitor that. Okay. Uterine tone, what do we think about that? We're giving all that fundal massage. We want to keep monitoring it, right? We want to make sure that we have gotten that uterus nice and firm and it's toned up and it's not boggy and bleeding anymore. Okay, temperature. So yes, we're going to be monitoring temperatures on all of our clients, right? Specifically, a temperature would be monitored very closely if we had retained placenta, because when the doctor goes in and does a manual sweep, it increases that risk for infection. So we would be monitoring the temperature in that case. But for this, we would just be monitoring like normal. Vaginal pain, of course, we're going to be watching that, but what do you all think about that? Not going to help us see if we have slowed or controlled that bleeding, right? Again, if it was hematoma, that would be more correct. And then same with the swelling. We'd be monitoring that swelling. All right. So do we all agree? We're thinking hemoglobin and uterine tone, right? You guys are doing so great at this. All right. And we see that we're correct. So I hope you all enjoyed this and found it helpful for you guys with our bow tie questions. Here are some links, and Krista will be putting them, if she hasn't already, into the chat on where you can find us on Instagram, TikTok, YouTube, and of course, Facebook. If you guys have any questions, please let us know. I know Krista's been busy answering any questions. If you guys head over to our website, you can get links to, or Krista should be putting a link to our awesome cheat sheets, and you can access more cheat sheets there, more bow tie questions and other questions, case studies, video walkthroughs if you haven't already. You can set up your study plan to help make your goals. All right, thank you all for joining, and good luck to anyone that has the signed up for the NCLEX soon. See you next time.